Hi, I'm Dr. Christy Sutton, author of Genetic Testing, Defining Your Path to a Personalized Health Plan. And I'm going to be talking about alcohol detoxification in your genes. And in conjunction with this book that I wrote, which goes through all the different genes, I also created this genetic report called Genetic Detoxification, which goes along with the book and has all the different alcohol detoxification genes I'm going to be talking about. Because some people inherit these genes where they don't detoxify alcohol as well, and it can increase their risk for cancers and various health problems. And so we're going to learn about that, and you can figure out if you have these genes. So if you've done 23andMe, then you can download your raw data from 23andMe, and then you can upload it to my website, Genetic Detoxification, and then you can print out your own report, and then you can go and look at my book, which there's a lot of information in this PowerPoint that I'm going to be presenting on, but you can go look at my book to read more about it if you want to kind of learn at a slower pace and be able to read it rather than just listen to it if you're more of a visual rather than an auditory, although it's nice to be able to do both. So we'll go ahead and get started. So alcohol detoxification and epigenetics. This is an important subject. So the pathway for detoxifying alcohol, so you consume the alcohol, which is ethanol, and then there's this enzyme called ADH1B that takes that alcohol and converts it into acetaldehyde, which is an even more toxic, intermediate toxic chemical that then your liver has to convert into acetate. So acetaldehyde is the chemical that makes you feel hungover, it makes you feel bad. That's the toxic that makes you just kind of feel achy, hungover, can cause flushing, increase heart rate, nausea, lightheaded. And then there's this other enzyme called ALDH1 that actually converts the acetaldehyde, the toxin, into a non-toxic chemical, which your body can easily remove, which is called acetate. So some people are very quick to convert the alcohol, the ethanol, into the acetaldehyde. And those people, they tend to go very quickly from like the happy-go-lucky phase to the hungover phase where they just don't feel very well. And it kind of decreases their desire to drink. Other people are very slow to go from that alcohol, ethanol, to the acetaldehyde. And so they have more of the drunk phase and not quite as fast to go into the hangover phase. And then if we look at the second part of this reaction, some people are very slow to go from the toxin, acetaldehyde, into the non-toxic acetate. And the people that are slow to do that, they tend to have more issues with their health as far as like cancer risk, flushing when they drink, the oriental flush, which is really common in Asia because this ALDH2 gene that makes them slower to detoxify alcohol, that gene is very common in Asia. So the people who are slow at detoxifying the acetaldehyde, they tend to have more issues with drinking and more side effects. Some people are fast, and so they don't have as much of a hangover. As people get older, they tend to have more of a hangover because these detox enzymes get a little bit slower usually. So we're going to talk about different things you can do to identify if you're at a high risk for having health problems if you consume alcohol because you have these genes. And what you can do to, change your environment so that you can support your health and hopefully decrease your risk of health problems. So the first gene that we talked about is the ADH1B and ADH1C, and that stands for alcohol dehydrogenase. So these are the genes in the Genetic Detoxification report. And there's the top genotype. If you have the risk allele, you're extremely fast at converting alcohol into the toxin. So you're not going to have quite as much of a jolly drunken phase because you're going to go a little bit faster to the hangover bad phase. So maybe you might just not really enjoy drinking as much for that reason. And then the second one in the middle, they're fast, not quite as fast as the first one if you have that A allele. And then the bottom one is very slow. So these people are going to have more of a buzz. And there's also an increased risk for becoming an alcoholic with this specific type because it's more fun to drink as far as, you know, you have a longer drunken phase and you don't kind of quickly go into that paying for it phase. So again, you consume the alcohol and then that ADH1B gene converts into the acetaldehyde, and then the ALDH2 gene converts it into acetate. So now if we look at the ALDH2 gene, which stands for aldehyde dehydrogenase, then if you have this is on the Genetic Detoxification report, if you have an A allele for this RS671 gene, then you are slow to convert the toxin acetaldehyde into the non-toxic chemical acetate. And if you have this risk allele, then you tend to have longer and stronger hangovers from drinking and are at a risk for various health problems, possibly a decreased risk of alcoholism because you don't have as much fun drinking. You pay for it with the hangover. So that's the good news, is your body's giving you the signal, this is bad for you, and then it's up to you to listen to your body. So, so these are some of the glutathione supplements that I tend to gravitate towards and use a lot of. And I have these here because glutathione is an important part of your liver being able to detoxify alcohol. So, for example, if you go to the hospital because you have acute liver toxicity from, let's say, drinking alcohol and taking Tylenol simultaneously, which is a pretty common reason for acute liver failure, because both alcohol and Tylenol deplete your glutathione levels very rapidly. So if you go to the hospital, then they're going to give you an IV of NAC. So NAC glutathione support, that's 900 milligrams of NAC, just pure NAC. And it helps your body to make more glutathione, which then saves your liver from the damage that would occur from not having enough glutathione. So that's one of the options. The glutathione complete, that's a liquid. And so that's, you know, a little bit more friendly towards kids or people that don't like pills. Although, I've used these in kids and adults to support glutathione levels and support health. But that glutathione support has NAC, has vitamin C, has a little bit of selenium. So it's a little bit more designed to, and it has glutathione in it. So it's designed to help you make glutathione, but also to help you have a little bit in there. The glutathione shield is a nice topical option because you absorb it transdermally, which means that, like, if you don't absorb glutathione well, or if you really want to saturate a tissue extremely well, like, for example, let's say you want to saturate your liver, so you can put a bunch of glutathione like over your liver, which is right below your right ribs. I've had some people that like to put a lot of this topical glutathione over their like breasts before getting a mammogram, because the mammogram radiates their breasts. So they want to saturate their tissues with this really powerful antioxidant that is extremely protective and supports, detoxification, but also prevents free radicals. So it does so many things. Not only does it help your body to detoxify alcohol, but it also helps your body to sequester and neutralize these dangerous free radicals. So I've had other people put it on their head when they get like a concussion, just to saturate their brain and their blood-brain barrier with all that glutathione to help prevent the leaky brain type thing. So lots of different options. The S-acetyl glutathione shield. S-acetyl glutathione is the most absorbable form of glutathione. And then the episilomerin, that's milk thistle, which helps your body make more glutathione. So that's a lot of just kind of going over the differences, idiosyncrasies. We have a lot of options and there's a reason for that. But all of these are good for supporting liver detoxification pathways. So jumping back into the genes, which is what we really want to know about, is So these people that have the ALDH2 risk allele, they are at an increased risk for cancer, especially when alcohol is consumed. So if you have the risk allele where you don't quickly convert that toxic acetaldehyde into acetate, then, which you know if you have that, if you've done 23andMe and create your genetic detoxification report at geneticdetoxification.com, you know, you're not guessing, you know if you have this gene or not. So these people have a significantly increased risk for developing cancer of the oropharynx and esophagus. And it's pretty significant. So, and it's particularly high with people that are drinking alcohol. So you can have this gene and not drink alcohol and not be at such of a high risk. There is also an increased risk for Parkinson's disease. Again, this is dramatically increased, this risk, if you are drinking alcohol. So Parkinson's disease is where the substantia nigra part of your brain is damaged. And basically your body doesn't make, that part of your brain doesn't make as much dopamine because it's damaged. So if you have this gene, then you're more likely to have damage in that part of your brain. However, it's less likely if you are not consuming a lot of alcohol, have lots of antioxidants like glutathione to support your brain, lots of polyunsaturated fatty acids, which we'll talk about in a little bit. Also, if you have this gene, you're more likely to get really red whenever you drink alcohol. And that facial flushing, that's called the Asian flush, the Oriental flush. And it's called that because it's very common in the Asian culture because ethnicity, because they just have that gene. And so this is a mitochondrial gene, meaning that it's on our mitochondria and it's passed down from mother to child. So if your father has the Oriental flush, then you probably are not going to have it. You won't, most likely. But if your mother has it, then you will have the Oriental flush most likely because mitochondria are passed down from mother to child. Other side effects, health problems related to having this: lightheadedness, especially when alcohol is consumed, more heart palpitations, again with alcohol consumption, nausea, low blood pressure, liver inflammation, liver toxicity, dry mouth, more intense hangovers. And that's because they have all that extra toxic acetaldehyde that their body's not getting rid of. Additional health problems. So increased risk of late onset Alzheimer's disease. That means onset of Alzheimer's disease that starts after the age of 65. And that's independent of the ApoE4 gene, which is the Alzheimer's gene. That gene is also in the genetic report, also discussed in my book. We're not going to talk about it very much today. But if you have this ALDH2 gene where you don't convert the acetaldehyde into acetate, then you're significantly more likely to develop Alzheimer's disease, regardless of having that Alzheimer's gene, especially if you consume alcohol. There's also an increased risk for developing osteoporosis, so especially in women. So that's very significant as well. And then neurodegeneration, Alzheimer's disease, Parkinson's disease, both of these are neurodegenerative diseases. So they even found that mice without this ALDH2 gene, mice that did not have the ability to detoxify the acetaldehyde into acetate, they displayed more of an age-related memory problems, like Alzheimer's. And they had more free radicals, the lipid peroxidation, which those free radicals tend to occur when you don't have a lot of antioxidants like vitamin C, glutathione, etc. However, the behavioral changes that they found in these mice with the neurodegenerative issues, they were improved when they gave these mice polyunsaturated fatty acids. So what are polyunsaturated fatty acids? They are, fish oil. So what I largely use is these three products. The high potency omega-3 fish oil is the most common one that I use. It is the strongest one as far as the highest amount of EPA and DHA for like one capsule. And I use that more of like an anti-inflammatory, cholesterol support, anti-inflammatory thing. That has a lot more EPA than it does have DHA. Whereas the high potency omega-3 DHA is really more just higher levels of DHA, which is really what your brain and your retina need. So The high potency omega-3 fish oil, the nice thing about that is that it's kind of pre-digested, so you don't get all of that fish burp. And then also it's easy to absorb. So I like that because it tends to kind of quickly help support lab improvement for cholesterol and stuff like that. The Epi omega-3 TG, that's the triglyceride form of fish oil. I don't use that as much, but it is a good option. It's a little bit less expensive, which is nice, but it does tend to give a little bit more of the like fish oil burping thing. However, all of these are excellent. The Epi omega-3 tends to be more of the higher EPA, lower DHA, just like the high potency omega-3 tends to be higher EPA, lower DHA. EPA is extremely important for lowering cholesterol. Studies that have shown that 3 to 4 grams of EPA per day can significantly lower cholesterol. Whereas DHA, studies have shown 2 grams of DHA per day have shown to be protective and support health as far as neurodegenerative issues. So coming back around, we got to this topic about these omega-3 fatty acids because the people that have this ALDH2 gene are at a more increased risk for neurodegenerative issues. And perhaps just like the mice that had improvement in the neurodegenerative issues with polyunsaturated fatty acid fish oils, perhaps humans would as well. We know that these are extremely helpful. There's a lot of research on it. And so, you know, it's something to look at closely if you have any of these genes. Why do I have vitamin D here? Remember, one of the genetic health risks, if you have that ALDH2 gene where you don't detoxify alcohol as well, is osteoporosis. So vitamin D is very important for bone health, as is vitamin K2. Vitamin D is also very important for your immune system and for regulating your immune system and also for detoxification. So we have 4 different vitamin D options. The first vitamin D option is the one I probably use most often, the D3K2 5000. So that's 5,000 IUs of vitamin D, and it has some K2 in it as well. So D3 helps you absorb calcium, K2 helps you deposit it into your bones. Of course, we all need to be exercising regularly with weight-bearing exercise so that our body is going to deposit that calcium in our bones, because every time you do weight-bearing exercise, your body deposits calcium in the bones. That's why people, the astronauts that go out into outer space, come back with bone degenerate osteoporosis, osteopenia, because they haven't been under gravity and their bones get weak because of it. So it's very important that D3 and K2 are combined so that you don't increase one's risk for cardiovascular disease. We want to calcify the bones, not the arteries. The D3 helps you absorb the calcium. The K2 helps you deposit it into your bones. The exercise makes sure that your bones are getting stronger. So somebody has a D3, a lab value of D3 maybe 50 or 60. I just want to bump it up a little bit. D3K2 5000. If somebody has a low vitamin D, and I consider really anything in the 40s and lower to be low vitamin D, I'll often suggest maybe take a bottle of D3K2 10,000, which would last for 2 months, and then recheck your vitamin D and see if it's gone up. And then if it's gone up, then you can go to the 5,000. If it hasn't gone up, then you can stay on the 10,000 until it goes up. I like to see vitamin D as a minimum of 70 to say 100. The range is 30 to 100. I don't like it to be lower than about 60-ish to 70-ish, because what the research has shown is a higher level of vitamin D protects you from immune issues, neuroprotective, protects from even autoimmune issues. So it's really important. The D3K2 1000, the liquid, great for kids or for people that don't swallow pills. Not super strong. I have found that I tend to have to, you know, give little ones a little bit higher amounts, which I'm comfortable with because I'm checking the vitamin D levels. But I think if you assume that you just give them 1 drop, 1,000 IUs a day, it's probably not going to get you as high as you think it would. So I would say maybe consider a little bit higher dose with that one. Although it's great for the little kids. I used that with my daughter for a long time. I've since Now she can swallow pills. And so now she does the D3 K2 5000 every other day or so. And her vitamin D levels are good. Now the K2 Forte D3 5000, that has extra K2 with the 5000 IUs of vitamin D. So this is what I like for people that are at high risk for osteoporosis, like people that have this ALDH2 gene, or some of the other vitamin D genes, which I will discuss at a later date in a different video, but are in the genetic detoxification report. So people that have osteoporosis, osteopenia, or maybe a genetic predisposition for those. K2, Forte, D3, cardioprotective, bone protective, support general bone and heart health. So coming back around, some of the other health problems associated with the ALDH2, increased risk for breast cancer. So having one or more risk alleles for this ALDH2 gene we discussed is associated with an increased risk for developing breast cancer. And that increased risk of breast cancer is independent of alcohol intake. So that means that even if you don't consume alcohol, you're still at an increased risk of breast cancer because your body does not detoxify the 4-HNE as well as it should, and the malondialdehyde. And so what happens is you get more of these toxic free radicals, and that causes more DNA damage. However, which just increases one's risk for breast cancer, DNA damage. So you can kind of add fuel to the fire by drinking, but really everybody needs to, I think, be a little bit more aware of their genetic risks for drinking and how big of a risk it is for them. And not drink if you're genetically if you're genetically predisposed to have health problems from drinking. And then the other side of that is make sure you have lots of antioxidants. If you're going to drink, make sure you're loading up on those liver support glutathione supplements. Also, an increased risk for cardiovascular disease with people that have this gene because they have more free radicals. So alcohol intake increases your risk for cardiovascular disease, period. Alcohol intake combined with this genetic variant where you don't detoxify alcohol dramatically increases your risk of cardiovascular disease. The free radicals are the problem. You've got to be supporting your body with antioxidants like glutathione so that you can get rid of some of these toxins that accumulate when the ALDH2 is not properly detoxifying these toxins. So epigenetic support, epigenetics. How does our environment change our genes? Epigenetic support includes limit or avoid alcohol consumption, increase intake of B vitamins like B3 and magnesium, support detox pathways with liver promoting nutrients such as milk thistle, glutathione, especially if you're drinking alcohol. Exercise, it decreases the risk of osteoporosis and cancer. Consider increasing vitamin B9 methylfolate and consider curcumin. The vitamin B9 methylfolate, vitamin B9 is inhibited from being absorbed when you drink alcohol, which is why I put that on there. And then consider curcumin. Curcumin isolated from turmeric has been shown to reverse the ability of alcohol to inhibit these enzymes that detoxify alcohol. So it helps to protect your body from alcohol because it helps your body to detoxify those enzymes that detoxify alcohol to work better and reduce free radicals.